House this morning. The following segment is sponsored by Aurora BayCare Medical Center. Katie Fernetton joins us live. Good morning, Katie.
Hey, good morning. I'm here this morning with Dr. Shawn Hennigan, and he's an orthopedic surgeon who is fellowship trained in shoulder surgery at Aurora BayCare. Now, doctor, today we want to talk about, we have heard a lot about this in Wisconsin, football fans all around, clavicle injuries, clavicle fractures, broken collarbones. After Aaron Rodgers suffered it, we all got, we're like, what's that all about?
Yeah.
So tell us a little bit about that type of injury.
A clavicle fracture is one of the more common fractures that we see involving the upper extremity of the arm. They're fairly common. They comprise upwards of about 5% of all fractures that occur, so they're very common. And the most common mechanism for a clavicle fracture is to fall on the side or on the shoulder. The bone has an S shape to it, and so when you land on one end of the bone and axially loaded, it tends to break in the middle.
So what type of treatment options are there if someone suffers one?
So every clavicle fracture that occurs is very unique, as is the person who gets it. So not all fractures are treated the same way. But more often than not, if the bones are aligned fairly well, just supportive therapy, a sling to support the arm, medications, and usually time will heal it. If the bone fragments are not aligned well, and there's a risk that the bone might not heal, then sometimes we do perform some surgery to realign the fragments and try to get it to heal.
And so the most important question for us, recovery time for someone who really uses that arm.
Yeah, so it really depends. The most critical thing to do is to achieve healing and get healing in the correct position. In the cases of surgery and non-surgery, typical healing time is upwards of 6 to 8 weeks. And it depends on the personality type of the fracture and also the person who sustains.
Awesome. Well, thank you for joining me this morning, doctor. If you need any more information, please visit aurorabaycare.com/ortho. Good day, Wisconsin. We'll be right back.